Hi, my name is Irene, and today we're going to learn the essentials of lifeguarding. Being a lifeguard requires the retention of a great deal of information. Some aspects of being a lifeguard are practiced on a day-to-day basis and do not require any further practice. These include professionalism, recognizing and preventing emergencies, knowing your zone of protection, performing scans, and many others. Lifeguarding skills, however, are rarely put to use. In order to retain these skills and for future use in case of an emergency, we must practice and review them on a regular basis. These break down to performing rescues, caring for respiratory and cardiac emergencies, treating injuries, and providing medical care. We're going to try to cover them as quickly as possible without going over any relevant material as in the lifeguarding textbook. So let's get to it. Rescues split into three categories: surface rescues, submerged rescues, and spinal injuries. Let's start with surface rescue. There are three types of surface rescues: front drive, rear hug, and the two-man rescue. We'll start with the front drive. Imagine you're in a stand, guarding, and you recognize a guest in the water struggling. Just like we begin any kind of rescue, you whistle to let the other guards know you need assistance. You point to the guest and you ask the rest of the guests to clear the pool. Now you perform a compact jump to get into the pool and you start swimming towards the guest. Remember to use whatever stroke gets you to the guest faster. For this one, the guest is facing you. So once you get to the guest, you pull out the tube from underneath your armpits and you extend the tube for the guest to hold onto. Now you kick towards the nearest edge of the pool to escort the guest back to safety. Now according to the Ellis book, you can use either flutter kicks or whip kicks for that. However, from my experience, whip kicks are way more powerful when carrying weight, and this will help you move faster. This is what the front drive should look like. So that's that with the front drive. Now let's move on to the rear hug. Same situation, you are guarding and you notice a guest in distress in the water. You whistle, you point to the guest, and you ask the rest of the guests to clear the water. Now you perform a compact jump and you start swimming towards the guest. This time the guest is facing away from you. So you reach the guest and from the chest you pull the guest backwards so that he is faced up, and the tube is transferred from underneath your armpits to between the middle and the upper side of the guest's back. Again, this is what the rear hug looks like. The two-man rescue is a combination of the front drive and the rear hug. This is used when a guest is freaking out and does not allow one guard to help him. In this case, you raise an arm and you call it backup guard. The guard in front of the guest performs a front drive, and the guard behind the guest performs a rear hug, and the two escort the guest to the nearest edge of the pool for extrication. So this is it for the surface rescues. Now let's move on to submerged rescue. Obviously, these are performed when a guest is sinking below the surface of the water. In this case, we use either the duck pluck if we got to the guest before he got too deep in the water, or the deep water rescue if the guest is beyond reach from the surface of the water. Let's look at what a duck pluck looks like. To perform this one, you swim to a position above and in front of the submerged guest. Hold on to the tube in the middle with one hand and submerge your head under the water so that you can see where the guest is and how the guest is positioned. With your other hand, reach out for the guest's hand and pull him towards the surface. If the guest is conscious, we use the front drive to escort him to the nearest edge of the pool for extrication. Otherwise, after we pull the guest onto the tube, we flip the guest so that he is faced up. The tube should be between the middle and the upper area of the guest's back, so that the guest's head is leaning back and the airway is open. Now's the time to perform an initial assessment of the guest's breathing and pulse, and get him to the nearest edge of the pool for extrication and further treatment. But we'll cover these later. Deep water rescue is performed when a guest is submerged and we cannot use the duck pluck to get to the guest. To start the deep water rescue, you swim to a point slightly behind the guest. You release the tube and you perform a feet-first dive. Keep diving until you reach a position directly behind the guest. Reach across the guest's chest with one hand and hold on to the tube tight. With your other hand, pull the tube strap so that it pulls you towards the surface. So this sums up rescues. Next we got spinal injury management. Imagine you're in a stand, guarding, and you notice a guest jumping into the water. Once the guest comes up, he holds his neck as if he is in pain and you suspect a possible spinal injury. You whistle, you point to the guest, and you ask the rest of the guests to clear the pool. Only this time you do not perform a compact jump entry so that to not disturb the surface of the water by causing waves. Enter the water slowly and approach the guest using breaststroke. Once you get to the guest, you verify that the guest indeed hurt his back or neck, and and you activate the emergency action plan. Unless unconscious, you must ask for the guest's permission to touch and help him. Next, you ask the guest to raise both arms above his head, and you squeeze the arms towards the head in order to limit spinal movement. This is called the vice grip, and this is what the vice grip should look like.
Once you got a firm grip on the guest, escort the guest to the nearest edge of the pool for extrication, where a backup lifeguard will wait for you with a backboard. The backup lifeguard will lower the board for you to load the guest onto. Transfer the vice grip to the backup lifeguard and begin securing the backboard's straps at the knees, the waist, and at the chest. Make sure that the straps are secured very firmly so that the guest's spinal movement is restricted as much as possible. The backup lifeguard should now finalize spinal movement restriction by securing the head. Hold the guest's head in place so that the backup lifeguard can release the vice grip and begin attaching the head immobilizer to the backboard. The guest is now ready for extrication. Get the board out of the water as slowly and as smoothly as possible. Once the guest is out, inquire for any allergies or illnesses and pass the information on to EMS once they arrive. So this sums up the rescues. To quickly recap what we learned, we went over the surface rescues, which break down into the front drive and the rear hub, submerged rescues, which break down into duck pluck and the deep water rescues, and spinal injury management. Tune in for the next videos on how to handle emergencies, treat injuries, and provide medical aid.